Right now, we're following any of the state guidance, and we are referring to CDC. But if mask wearing for those who aren't vaccinated is also part of our policy on campus.
Mm-hmm.
And right now, what we want to do is get everybody vaccinated. This is a really big push. The president sent out a message on Monday and set this aspirational goal for 100% vaccination. Our Health Sciences Center had done a 10 to 100 challenge. They're at 93% vaccinated right now. But to keep us safe and also to just really create this culture of efficacy in protecting ourselves and the PAC and our community as we move forward from COVID, from flu, not coming to work sick, really being mindful of our health and the health of our community and the impact that it has. That's the long-term goal. The short-term goal is to get people to be vaccinated. We'll be offering some incentive drives. We'll be promoting this heavily in the upcoming weeks before our students return to campus.
That is a perfect lead-in to Gabe Sanchez from the UNM Center for Social Policy and the study you folks have taken on to find out why, in fact, Gabe, folks are not willing to get vaccinated, sometimes after the first vaccination, sometimes zero. Let's talk about the study. This is very interesting. I didn't realize how large it was. Tell us about the goal, what you wanted to get across with this study.
Absolutely. Thanks for having me, Gene. Great to see you. I think the overall study was massive, over 20,000 respondents across the country. And we had a New Mexico oversample. I think 2,050 some odd New Mexicans participated in our study. And it was really focused exactly as you noted, identifying, at that point, how many folks have been vaccinated, what are some of the obstacles or barriers to vaccination, particularly for diverse communities, and what messages could be paired with messengers to try to increase uptake. And fortunately, we had a sample specific to New Mexico of young adults that included college students. So hopefully we're thinking our data could help inform the efforts of UNM and other higher ed institutions in the state.
Was there any one solid thread of thought that you folks uncovered in this study that said this is why folks are refusing to get vaccinated?
Well, I'll talk specifically about the young adults, and that for us and our survey is 18 to 29-year-olds. And it was a mixture of both just lack of basic information. Young adults in our survey sample were much more likely than the older segments to identify that they really didn't know all the details on how to go about getting vaccinated. Wow. And unfortunately, a high percentage of those folks indicated that one of the barriers for them was cost and that they might be unemployed. And we know here in New Mexico, that doesn't matter, right? So it's an indicator to us that just basic information, that it's free and open to everybody, could really help, particularly those young adults and college students, to get vaccinated. Sure. And one of the best outcomes from our survey is we tested a number of different incentives and posed those at very low amounts, $25 all the way to $500. And fortunately, I think for the university, young adults and college students were more likely than the older segments of the population to say yes. Even a small incentive, as small as $25 to $100, significantly increases their likelihood of getting vaccinated.
Let's peel back to something you mentioned earlier that is very important. That is how these things are seen inside various disparate communities. Let's take the African-American community first. And there was a focus there in the study, but very interesting to kind of see this as well, that, it's very well documented, the hesitancy in the African-American community for these things. What was your research telling you in that regard?
What really stood out for us when we think about the Black population was the Johnson & Johnson, a particular brand of vaccination. And our colleagues at the AARC pointed out early on that part of this is ongoing challenges with Johnson & Johnson as it relates to talcum powder and other things that disproportionately impact the African-American community. So there was already a lack of trust, if you will, among that particular brand. And that obviously is filtering over into thinking about the vaccines. And another piece of the puzzle is we asked about discrimination experiences that all survey respondents across racial groups have had, particularly with the medical industry or the healthcare systems. Mm-hmm. And both the African-American and Native American community were much more likely than other racial and ethnic groups to say that they've experienced unfair treatment within the healthcare system. And that definitely has implications for just trust in the vaccine.
Do some of the same things you just mentioned apply to Native American population as well on that hesitancy part?
Yeah, absolutely. Some upside is Native Americans here in New Mexico have been among the leaders in terms of early vaccination. Mm-hmm. And I think that's a direct credit to everything our tribes and pueblos have been doing to try to make vaccinations as readily available to the community as possible. So that's the upside. The downside is once you look at folks who have not been vaccinated yet, Native Americans have some of the highest levels of hesitancy.
Hmm.
And again, lack of trust from both the federal government, state government, healthcare industry is a major factor for Native Americans, and for good reason. But another interesting trend that I was looking at actually early this morning within our data is that for Native Americans, particularly those who have underlying conditions or who are obese or perceive that they are, there's a large hesitancy to get the vaccination because they're hearing, and this was widespread from national health experts, that folks who do have things like diabetes or who have been told that they're obese are going to have a greater likelihood of having complications, if there are any, from the vaccine. So some of this is, again, the underlying inequalities that face a lot of our communities as it relates to healthcare and access to healthcare are definitely feeding into some, let's be honest, some good reservations.
The Hispanic communities particularly, any hesitation there that's particular to this population?
Yeah, one of the things that's not unique to Hispanics, but sticks out in the data, and is consistent with what I've been hearing from nonprofits on the ground, is that there's a significant concern, particularly in this economic climate, where a lot of folks have lost jobs or just starting back to finding a job. There's a lot of concern that if I get the vaccine, I'm hearing from folks, I might be out of work for as much as a week, right?
Oh,
Because
wow.
of side effects associated with the vaccine. And that's particularly high among our Hispanic population. And it's another one that's logical, right? If I'm just getting back on my feet, I'm starting to generate, some revenue with the new job, and I'm concerned that if I have to ask for time off, am I going to be able to keep that job? So again, I think a lot of what we found in the survey actually is pretty rational in the context of some of the decisions that folks are having to make when they think about, particularly getting the second dose.